Good day, Wonder Nurses. I'm Nurse Anne. Today, we will discuss what are the important things and nursing considerations to remember about the different medications that we are giving to our patients. So, if you're ready, let's start. The first on our list are cardiac glycosides. The common example of these medications is digoxin and digitoxin. What are cardiac glycosides? They have positive inotropic and negative chronotropic, which means they increase the strength or force of the heart's contraction and decrease the heart rate. Therefore, we should monitor the apical pulse of the patient before administering these kinds of medications. If less than 60 beats per minute, withhold the drug. Cardiac glycosides are also contraindicated to a patient with hypokalemia. Therefore, it is important to check the serum potassium level of the patient, and if the patient is already receiving this kind of medication, monitor his or her serum potassium level. So what is the normal level of potassium? It is 3.5 to 5.5 max per liter. We also have what we call digitalis toxicity. It is when the patient took too much digoxin or digitoxin and the therapeutic level is already beyond the normal range. The normal therapeutic range of cardiac glycosides in our blood is 0.8 to 2 ng per ml. The common manifestations of patients are GI and visual disturbances. Our antidote is Digibind or Digifab. Due to its action, it is the drug of choice for a patient with chronic heart failure. Next are the very common anti-hypertensive drugs. There's a lot, but let's discuss it in general. Check the blood pressure before giving the medication, then monitor. Most of the anti-hypertensive meds are for maintenance. Therefore, it is vital to emphasize taking the medication routinely. Lastly, instruct the patient to be careful when rising out from bed or to rise slowly because of its common side effect, which is orthostatic hypotension. We also have thrombolytics like streptokinase and urokinase. Thrombolytics dissolves blood clots or thrombus in our blood vessel. The common indications for this drug are myocardial infarction, deep vein thrombosis, and pulmonary embolism. Important considerations. Do not give to a patient with active bleeding and a patient with recent major surgery. Monitor for any signs of bleeding, allergic reactions, and check the patient's blood pressure. Finally, instruct the patient to avoid dark-colored foods while taking the medication. Next is anticoagulants. If thrombolytics dissolve blood clots, anticoagulants are medicines used to prevent blood clots formation or reduce the coagulation of blood. They are also known as blood thinners. The most common anticoagulants are heparin and warfarin. First, let's talk about heparin. It must be given parenterally because it is not absorbed through the GI mucosa. For pregnant women, It is the anticoagulant of choice because it does not cross the placenta. If the patient is taking heparin, it is important to monitor the activated partial thromboplastin time or the partial thromboplastin time because symptoms of overdose may show excessive prolongation or bleeding. The normal APTT is 30 to 40 seconds, while for PTT, it is 60 to 70 seconds. For heparin toxicity or overdose, the antidote is protamine sulfate. On the other hand, is warfarin. It is taken orally and is contraindicated to pregnant women because it can cross the placental barrier during pregnancy. It is important to monitor the prothrombin time while taking warfarin. The normal range is 10 to 13 seconds. If there is an overdose or toxicity, stop giving the medication and give the antidote, which is the vitamin K. Since warfarin is a vitamin K antagonist, it is important to instruct the patient to decrease the intake of foods that is high in vitamin K, like green leafy vegetables, while under warfarin treatment. Next is antilipidemic drugs or lipid-lowering agents, like simvastatin, atorvastatin, and rosuvastatin. It lowers the total cholesterol and triglycerides level in the blood. The normal range of total cholesterol level is less than 200 mg per dl. For triglycerides, it is less than 150 milligrams per dl. It is important to monitor their liver enzyme because it may cause an increase in SGPT or SGOT levels. Given these points, it is contraindicated to patients with liver damage. It is also best to take it at night or before bedtime because most cholesterol is synthesized when dietary intake is at its lowest. When checking the lipid profile of a patient, it is vital to instruct the patient to fast or NPO for 10 to 12 hours before the extraction time. This is important to emphasize because it may affect the accuracy of the laboratory result.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.